Hello, everybody. Today I am going to talk about crying baby, which we have discussed previously and discussed about what are the red, yellow, or green signs. Today we'll be going to discuss about underlying cause. This crying behavior of the babies usually peaks from 2 weeks to 4 months of age, and this is normal development process and it will settle usually at 4 to 6 months of age. What possibly the causes of crying of these babies? You can be that related to the hunger. Baby is hungry, dirty nappy. Maybe baby is tired, want a cuddle or reassurance, abdominal wind, feeling hot or too cold. So, for parents or carer, we will advise try different winding position, skin to skin contact, rocking, singing, or music, a warm bath after first week, going for a walk or short drive. Do not encourage long period in a car seat. So basically, these are the ways you can manage the excess cry. Now, there are other conditions that can cause excess cry of the baby, like reflux. Reflux is because muscular valve at the end of the food pipe keeps food in the stomach, is still developing, and it's not that tight enough, and uh, cause your baby to bring up the milk after feed, and also can give him or her hiccup. If the baby is growing normally and not showing any marked signs of distress, nothing to be worried. But in case of severe reflux, often after feed, we call gastroesophageal reflux disease. So basically, that causes the food and stomach acid back in the food pipe and causes discomfort. If there is if you just try that some of the you know that we already advised, some of the thing that if not help, then you have to see health visitor, and that time they can ask how to help your baby, whether baby need further any support. So these are the thing. Also, some of the infection can causes the problem excessive cry, and temperature above 38 degrees centigrade or 100.4, most likely viral urine infection, but sometimes serious infection like sepsis or meningitis. In case of severe infection, baby can become pale, floppy, blue around lip, excessive miserable when touched, difficult to arouse, difficult to breathe, and develop a rash that does not disappear on pressure like gas test. So in that case, you have to go to emergency as soon as possible. And there are also a possibility of having colic or constipation in the babies. So in this colic, that causes frequent crying, otherwise quite healthy baby, and causes unknown usually, that due to intestinal discomfort, like that. When it usually starts in the few weeks of old and stops in the 4 months of age, but at least maybe up to 6 months of age. Um, so basically, there will be no underlying cause. Cries high pitched, and nothing seems to helping. And same time, sometime each day, afternoon or evening, draws the legs when cry, clenches their hand, face must be flushing, can last for minutes to hours, or with colic can cry for 3 hours a day or more. Often wind crying often goes down, and baby is exhausted, and they may have to have passed wind or poo. So that is another cause of this. And last one is constipation. That sign of crying, discomfort, irritability during poo, hard palate like poo, foul smelling, and also hard belly. Not too much worry about the constipation. Um, So gently move your baby's legs and bicycling movement that help to move the heart poo. And if they be drinking formula, give them extra water in between bit, but do not dilute the formula. So too much powder can dehydrate our baby and causes constipation. Um, so for the baby under 6 months, use water from the main tap of kitchen. So basically, then if you use the water from tap, you need to boil and then cool it because it is not sterile straight from the tap. Water for babies over 6 months of age does not need to be boiled. So these are the few tips you have to check. I have mentioned before the urgent cases you have to go to the um, emergency, but not urgent you can speak with local pharmacist. So also in between you want to talk with your GP or NHS 111. That is also good to discuss about your problem. And of course, remember about self care because this is distressing to have a crying baby at home. So it is really important um, to have your self care. Hope you get some idea about crying baby. We will again discuss another topic next week. Bye for today.